Hello all, this is Dr. Murli Bharadwaj and you are watching the most favorite patient education video series, Clinicopedia. Today we'll talk about diabetic neuropathy. Whenever you get diabetic neuropathy, the most important thing is you need to take care of your feet. How to take care of your feet, we are going to talk now. How do you know that there is a complication of neuropathy has come to you if you are having a history of diabetes? If there are any pins and needle sensation, or if there is any pain in the feet, numbness, you are not able to feel what is underneath your feet, then think there's a possibility that there is neuropathy. But why diabetes affects the nerves? If you take a nerve, it is just like any other organ in the body. It wants to eat, it wants to have oxygen, it wants to breathe. From where will all that come? It comes to the blood in the blood vessels. So those tiny blood vessels which supply the blood to the nerves are called as the vasa nervosum. If there is any fat deposition in them, then the nerves will suffer, and that is called as diabetic neuropathy. Now, how can you predict or how can you postpone the development of this complication? There are two factors that decide whether neuropathy comes as a complication or not. Number one is the duration of the diabetes. The longer the duration, the greater the chance that you can be kissed with the complication of neuropathy. Second is how tightly you are able to control the blood sugar. That's the reason, have a good eye on your blood sugars, control it well, and that is the way, only way by which you can avoid the complication of neuropathy. Now, whenever you get neuropathy, you are not able to feel the pain. So that is the reason, if there is any injury to the feet, you will not perceive it, and that can lead to a long-term damage. That's the reason, if you have diabetes, first love diabetes. Every third and fourth person has got diabetes. You are not the only one. Second, love your feet and love a good quality of life. So I will tell you 10 important ways by which you take care of your feet when you have diabetic neuropathy. Number one, check your feet daily. Just like when you are going to the office, you will check your face in the mirror. You need to take care of your feet like that. Check, are there any blisters? Is there any infection? And immediately respond to that. That's the only way you can save your feet. Wash your feet daily. And whenever you are washing, don't use hot water because your feet cannot perceive very well how much hot the water is. That's the reason better is lukewarm water and soap. Dry your feet, especially between the toes. Let not any humidity stay there. It can promote infection. Apply a moisturizing lotion, but remember, don't apply it between the toes. That's very important. Trim your nails, otherwise your own nails can damage your skin in the night without your knowledge. So that's the reason, trim your nails properly. Then change the socks daily. Let not stinking socks be worn. That's very important. And never walk barefoot. Outside the house or inside the house. Don't walk barefoot. That's most important thing. And try those exercises which do not put any pressure on your feet. Like you can do swimming, you can do cycling, you can do yoga, you can do tai chi. That's all permitted until you are not putting any weight on your own feet. Then you fix any problems like bunions or corns or the hamateurs. Very, very important. And if the pain is unbearable, then you may need to go to a podiatrist and he will give you a orthotic support, especially when your muscles have become very weak. And you may need a foot brace or an orthopedic shoe that can help you. And this is a classical example of one such extra gadget which can improve the quality of your life. This is called patella tendon bearing orthosis, which will try to prevent the weight falling on your feet and ankle. And similarly, this is called ankle-foot orthosis. So suppose if the muscles have become very weak, then definitely you may need to take a consultation and look forward for these extra gadgets. So if you take care of your feet, then your feet take care of you. So keep connected with us. Clinicopedia will help you to socially network with the other patients just the way you do a networking on the Facebook or on the LinkedIn. Today, download the Clinicopedia. Thank you.